So when you ask, it's important that it's not pro forma. Like people say, I have to ask everybody this question. Are you thinking of killing yourself? Or you're not thinking of killing yourself, are you? This is not going to lead somebody to talk about what they're feeling. And because there are other risk factors that you may notice, it's really important to know where they are on this question. I generally say killing yourself instead of suicide because I find that suicide, people have different ideas about what that term means. But you will develop your language for taking one's life. I usually say, are you thinking of taking your life? Now, another question that people often confuse with taking your life is, are you thinking of harming yourself? Because they feel uncomfortable with the word killing yourself or suicide. Harming yourself is really different from suicide. I watched somebody do a great ask about, a great evaluation of somebody who was really struggling with depression, except when they said, and are you thinking of harming yourself? And this was a teenager. He said, well, no, I wouldn't do anything, but I wouldn't care if something happened. Now, the good news is that the clinician didn't stop with that and said, well, what do you mean? And he said, well, if I were skiing and I broke my leg, I wouldn't feel bad about it. So it was completely different from what the clinician thought he was going to say. And because he pursued that question, he got an understanding about where that person was in terms of thinking about suicide.